I'm on the one hand very glad that I can join you today for this conference, but obviously I'm also very sad that I cannot do this in person. I would have loved to be in Budapest today, but well, that's how the times are, and at least I'm here on the screen. Let me give you a short glimpse on North Rhine-Westphalia. Some of you might be familiar with that, but not all of you, I guess. So North Rhine-Westphalia is the most populous of the German federal states with 18 million inhabitants. It has a GDP of more than 700 billion euros. So as a standalone country, it would be the 7th biggest economy of the EU or the 19th biggest in the world. And of course, we also have been hit very hard by the crisis. As of today, we have 65,000 cases of COVID-19, 5,000 of them still active, 1,800 people have died from COVID-19 in North Rhine-Westphalia. And from the beginning, we tried to strike a balance between restrictions of individual freedoms and economic activity on the one hand, and fighting the pandemic decisively. And we always try to adapt dynamically. So if the number would decrease, we would open up, and if the number increases, returning to some of the more stricter measures. As you all know, the COVID-19 crisis proves to be one of the most far-reaching, most unpredictable, and most deadly challenges in the history of European integration. It has demonstrated that even the most successful achievements of the EU, the 4 freedoms, the coordination of policies, a sense of solidarity, are still fragile. At the same time, however, the crisis has underlined the need for a coordinated and truly European response to such crises. It is still difficult to assess the damage the pandemic has done and is still doing to health, to economies, and to virtually everything else. It is certainly too early to estimate as to how the COVID-19 crisis will affect the further development of the European Union in the long term. It is nevertheless important to discuss which lessons we can already draw from this crisis. Looking at the events of the past 7 months, we can make 2 seemingly contradictory observations with regard to political procedures and institutional capacities at both the EU and the national level. On the one hand, the EU has, as a collective body, was perceived as being weak. Many observers have blamed the EU's limited competencies in the field of public health for its apparent inability to coordinate the emergency measures adopted by member states. On the other hand, decentralized regional emergency response measures proved to be the most effective in managing the direct and indirect consequences of the pandemic. It was the knowledge of regional specific challenges and the situation on the ground that equipped regional and local authorities, unlike any other actor, with the prerequisites for swift and targeted crisis management, and that is certainly true for North Rhine-Westphalia. How do we approach this paradox of crisis management? I would argue that we should rely on a broader interpretation of the notion of subsidiarity and a more inclusive understanding of multi-level governance as a network rather than a hierarchy. In the Committee of the Regions, where I had the German delegation at the CIVEX Commission, we speak of active subsidiarity that encompasses establishing structures that actively feed experiences and information on the ground to the decision-making process on the national or the subnational, the supranational level, for instance, the Brussels decision-making process. And I think the conference on the future of Europe is a very powerful tool in strengthening this perspective. But then, of course, it's not enough that it's just a listening exercise. It has to lead to decisions and to change. My first point is that the European Union was not entirely unprepared for the COVID-19 crisis. Mechanisms such as the early warning and response system and agencies like the European Centre for Disease Prevention and Control were in place well before the occurrence of COVID-19. And it's certainly not wrong now to consider how we can further strengthen these existing structures. A more extensive budget for ECDC could be a starting point, but of course it's not just about money. Any such mechanism or agency can only function if member states are willing to cooperate and willing to utilize the existing mechanisms. Thus, the shortcomings revealed by the pandemic were not so much institutional, but rather political in nature. This is also why we cannot blame the Union's perceived lack of competence in the area of public health. Even if the EU had had the competence to take binding measures in response to the pandemic, it would have lacked an adequate database and knowledge of the situation on the ground. This is where regional and local actors come into play. And this leads me to my second point. Regions are key players in crisis management. The effects of the pandemic have varied strongly between regions, both in timing and extent. Geographical, cultural, and socioeconomic factors seem to have been crucial. Actors on the ground can best understand and react to those variations. Thus, a crisis response system coordinated at the EU level must be strongly linked with the regional and local actors. Ideally, direct links between the two exist. However, and this is my third point, for the time being, even at this advanced stage of European integration, member states are still our main point of reference when it comes to political decision-making. Member states provide the legal framework for rules and regulations to be adopted in response to the pandemic, or in centralist states, take such measures themselves. The most far-reaching decisions were taken at the level of member states, for instance, closing borders, imposing rules for entry and travel, and so on. This assessment must be taken into account in any crisis management mechanism. What we need, therefore, is not more centralization, not more hierarchy, but reliable EU mechanisms and a more inclusive understanding of multi-level governance. We need to improve the network between all regions, member states, and EU bodies, not in a hierarchical sense, but cross-cutting. The next crisis might be an entirely different nature. To create a truly resilient European Union, we must establish a transverse rather than a sectoral approach. For instance, we should strengthen procedures before we look into competences in individual policy fields. However, any such mechanism, in fact, any form of cooperation in the European Union can only function on the premise that each member state fully complies with the treaties and, of course, with the fundamental values of the European Union. Despite the need to take extraordinary measures, fundamental principles such as the rule of law and democracy, as well as fundamental rights, must at all times be respected. Where a state of emergency is necessary, it must be proportional, legitimate, clearly limited in time, and subject to judicial review. In North Rhine-Westphalia, we had a very intense exchange on that between the government and our state parliament, and finally found a way to, on the one hand, safeguard proportionality and also establish parliamentary control. The Commission's annual Rule of Law report could be an important instrument assessing the scope and proportionality of emergency measures. Compliance with the fundamental principles is a precondition for trust between member states, and this trust is indispensable for European cooperation, particularly in uncertain times of crisis. To conclude, the COVID-19 pandemic has challenged many of the achievements of the European Union, which we have taken for granted. But it will unfortunately not remain a unique incident. So-called transboundary crises, for instance, crises that transgress borders between member states and between policy areas, will certainly reoccur. And the success of European integration will be judged according to the EU's capacity to deal exactly with those types of crises. The Union therefore needs at least three things to make it more resilient: a functioning crisis mechanism based on closer cooperation and concentration, a tight network between political actors at all levels based on a spirit of solidarity, and the political will of member states, even in such extraordinary times, to act in compliance with their obligations under the treaties, such as sincere cooperation and full respect for the Union's founding values. The crisis has certainly proved that there is much work for us to achieve this aim. But we have also seen some signs for hope and initial steps in the right directions. Political leaders have demonstrated political will and solidarity. That is why between 17th and 21st July, we saw one of the longest European Council meetings in history. But it achieved results. Actors at all levels have demonstrated an unprecedented level of creativity and flexibility. For instance, in Sweden, the region Östergötland launched a collaborative platform to connect job seekers and employers. On Malta, an online platform enabled politicians and staff in local councils to maintain dialogue and coordination with the communities. And in Rhine-Westphalia, we launched a cross-border task force, Corona, with our partners in the Netherlands and Belgium to ensure a constant exchange of information and coordinate policy responses. That gave us the possibility to keep the borders open, which was not the case at other border regions in Germany. Thus, the good news is we have the capacity and structures to establish and use such crisis response mechanisms and to build a more resilient union. So let us make use of the lessons learned and the impetus for change gained through the pandemic so far. Thank you very much.